And this is picking up right where we left off in the 6.2 lecture. So we've just discussed the 10 factors that will help us to reduce total fertility. Now we're going to talk about some factors that are going to affect death rates. Okay, first term that we need to be familiar with is life expectancy. Again, another thing that we discussed during the class work activity where we looked at the statistics for the 5 regions. What your life expectancy is the number of years that a newborn should live in that country, average number of years. And what we tend to see is that for the United States that we have a life expectancy of around 78. We are, in fact, though, decreasing for the first time ever in the last couple of years, and that's because of the obesity epidemic that we see in the United States much more than they see that in other countries. The best life expectancy is in the more industrialized Asian nations among women. Women tend to do much better than men, and by much better, we're just talking about a couple years, but women do live longer than men. Now, globally, we have seen an increase. It was a 48-year life expectancy for a newborn in 1955, and that has risen to 68. So that's good. That's on a global front. But if we look at sub-Saharan Africa, we see that their number is 49 and falling. Now, again, the book is a little bit different in its recency than the statistics we worked with in class. If you remember in class, we said that Africa has a life expectancy around 55. Well, it's not all accounted for by just what year we're talking about, 2008 versus 2010 data. The major difference here is that we are looking in this case with just the sub-Saharan Africa countries. Those are the countries where we tend to see more infectious diseases. The top part of Africa behaves a little bit more like Europe and like the Middle East. The southern Africa portion is much more tropical, so that lends itself to many more diseases. And you tend to see just different levels of industrialization there as well. So life expectancy, again, average number of years that a newborn can expect to live. Infant mortality rate goes again along with the infants there. And we're going to use the term IMR to talk about infant mortality rate. Infant mortality rate is the number of babies out of every 1,000 born that will die before their first birthday. We don't count stillborns, we don't count abortions. These are babies that are born out of their mother and they are alive. Again, not stillborns, not miscarriages, none of that. But these babies were born, and sometime after their birth, before their first birthday, they pass. In the United States, a lot of our infant mortality is related to SIDS, which we're still not sure what the cause of SIDS is. But in other countries, there are many, many different reasons. Africa, one of the leading killers of children is diarrheal diseases. Now, if we're talking about an infant, they're not drinking water, but if we look at that number of doctors per, let's see, what is it, one doctor for about every 1,700 people in Africa, they don't have access to medicine. So if a baby gets sick, it's very unlikely that the baby will get better. Because of that, infant mortality is viewed as one of the most true measures of a society's quality of life. The better off you're doing treating your infants, it tends to be you're doing much better taking care of everyone. So if you've got a low infant mortality rate, you are seen as having a very good society in general. It reflects medical care and nutrition. Again, not just for the infants. Mostly the infants at this stage are going to be nursed globally. But again, that means the mothers are getting medical care. It means that people in the society have access to good nutrition. So IMR tends to be a very, very important statistical factor to look at when we look at quality of life around the world. Several factors are affecting our death rates. So people are living longer. We said that with life expectancy. Fewer infants are dying. But why? First off, we have increased food supply and distribution. This might not seem that critical from the U.S.'s standpoint, but for other places it most definitely is. We are able to ship food and grain around the world. Remember that the U.S. and China are the 2 leading grain producers, and so our ability to move that food supply around means that people globally can get access. We do have better nutrition. Again, you have to look at the United States as a little bit of an anomaly here. We have access to plenty of food, but our nutrition is getting worse. And as a result, for the first time again, we are seeing a decrease in life expectancy. But on a whole, globally, and that's what this class is ultimately about, globally we are seeing much better nutrition. And we're going to talk a little bit in the next unit about ways that we add nutrients to foods that otherwise wouldn't have them. A great example just on your dinner table is iodized salt. Iodine helps to prevent certain thyroid disorders. And so by getting that iodine in our table salt, we don't need to worry about getting it in other pieces of our diet. And so just the scientific knowledge to do that makes us able to live longer. Medical advances, obviously, the better our doctors are, the better our care, the better our medicine, the better our prescription drugs, the longer people are going to live. There used to be, a death sentence to hear that you had cancer, and now we're finding ways to fight it. And so those medical advances are paramount to people living longer. Improve sanitation. I told my classes, I know that back around the 1800s, they didn't know that they needed to wash their hands between patients. And if you guys remember from earlier in the lecture, 1907, most medical doctors didn't have a degree. So the small step of learning to wash our hands, sanitizing medical equipment, saved many, many lives that were otherwise lost due to very simple things like septic. Okay, but infant mortality rate is very high in the United States compared to where we ought to be. We're number 41 globally, or at least we were when this book went to press in 2008. And there are three primary reasons for that number being so high. Again, we put ourselves in the top most countries. If we look at our economy, if we look at our level of medical care, so it's unacceptable that so many infants die, and that again presents us as having a lower quality of life than we really have. But you're going to see that we don't serve all members of our society equally. So what are some reasons why we have such a high infant mortality rate? First and foremost, it is inadequate health care for poor women during pregnancy and for their infants. We do not have good ways to address the needs of our impoverished population here in the United States. Getting them adequate health care helps to ensure the safety of their children. And so when they are not getting the proper prenatal vitamins, when they're not getting proper checkups, it could put the life of their child in danger in that first year. So high infant mortality rate. We also tend to see a lot more drug addiction among pregnant women in the United States than you're going to see in European or in Asian countries. And those are where the countries are that we're comparing ourselves to. We're comparing ourselves to Japan, to the United Kingdom, to Sweden, to Switzerland, and they're not going to see the same issues with poverty and race relations that we tend to see. So drug addiction becomes a huge, huge factor. And the third one can't be stressed enough, especially to the population I'm speaking to. It's a high birth rate among teenagers. Teenage bodies are not designed to carry full-term pregnancies. And so when we see teenagers, especially very young, 13 and 14, getting pregnant, having children, those children are low birth weight, those children are not fully developed as far as their lungs, and so those children have a very high likelihood of dying before their first birthday. So our infant mortality rate in the United States is not what it should be, and it reflects on our social issues that we face in our country. So again, you might not think that these things are of incredible relevance to you in your life, and they might not be. But as a country as a whole, if we are better able to take care of these issues, our society as a whole improves. And so if our infant mortality rate can drop, then it will show that we take better care of our people in the United States. So that's, again, what we're talking about when we say that infant mortality is a great indicator of social quality in your country for everyone. Migration is another major area. We've talked about births, we've talked about deaths, and now the other thing that can affect your population size is the migration. Why do people come into certain areas? For economic improvement, religious freedom, political freedom, to avoid wars, or because they're environmental refugees. And this would be in the case of, let's say, tsunami or flooding or earthquake, where they would have to move out of their normal place, their normal, whether it's a country or a city, and seek refuge somewhere else. We saw a lot of this in Atlanta after Katrina. Now, again, they're staying in the United States, but we did have migration between states. The United States population stayed the same, but again, we did see state-to-state migration after Katrina. The United States, never forget, is a nation of immigrants. We started this nation, we being the Europeans, started this nation as a place to come for religious freedom, for prosperity for all. And ever since, since 1820, we've admitted twice the number of all other countries combined when we talk about immigration. Again, it's hard to say that the United States shouldn't allow for immigration when we are a nation of immigrants. Our legal immigration is mostly from Latin America and Asia. That's, I suppose, not surprising. Illegal immigration, also not surprising, mostly from Mexico and Latin America. What's important to note is that to maintain our current ratio of workers to retirees, we have to accept immigrants, 10.8 million of them per year. We're going to talk later on in lectures about what the problem is if your retiree base grows and your worker ratio then shrinks. And it puts a lot of burden on our taxes, and it will create major, major economic issues. So we face a problem now where we really do say to ourselves, there is a necessity for immigrants, and that's going to be a very big political battle to face in the years to come so that we don't become a France. And if you don't know what that means, you should look it up. France had some riots, and it was all about workers and workers' rights, having to do a lot with their immigrant population and their retirement age going up. So really, really interesting stuff. And we know that Europe is a little bit ahead of us with demographic transition. And so France should be a case study that we look at and learn from. Here's a look at the immigration in the United States between 1820 and 2003. And what you can see is that, again, we've always been accepting immigrants. There are some peak years and some down years. You see 1907 was a high year. You got new laws in 1914, and that saw a great dip, but it bounced back again in the Depression. Again, people coming here to seek economic prosperity are not going to come here if there's a depression, and so that hurt immigration numbers, but then they increased steadily, and we saw another big spike right in the 1990s there, and then it came down into a normal growth rate. It would be interesting to see just how this changed after 2003, because we did have our attacks on the trade towers, which massively impacted our immigration laws. And that is the end of 6.2. So this one was a little bit longer of a section. Sorry about that. Hopefully 6.3 will treat you a little bit better.